The gluteal region. The gluteal region includes the soft tissues located on the external aspect of the pelvis and enclosed within the following boundaries: superiorly, crista iliaca; medially, the lateral margin of the sacrum and the coccygeal bone; inferiorly, the gluteal sulcus; and anteriorly, the line connecting spina iliaca anterior superior and trochanter major. The external surface of this region is concave depending on the size of the underlying muscle and overall fatness. The outline of this region is marked by externally palpable landmarks, crista iliaca and spina iliaca anterior, superior, and inferior. The skin of the gluteal region is thick and rich in sebaceous glands. The superficial fascia has abundant adipose tissue which is divided into round lobules by transverse fibrous septum which connect the skin to the deep fascia. Cutaneous sensory innervation of the region is provided by Cluny nerves superior, middle, and inferior. The deep fascia, fascia glutea, extends superiorly into fascia thoracolumbalis and inferior into fascia lata of the thigh. The muscles in the gluteal region are arranged in 3 layers. The outer one is gluteus maximus muscle. The middle layer includes the gluteus medius muscle, piriformis muscle, the superior and inferior gemelli muscles, the tendon of obturator internus, and quadratus femoris muscle. The inner layer is formed by gluteus minimus muscle and externus obturatus muscle. Muscle piriformis has a key position in the region, acting as a landmark for identifying the course of the gluteal nerve vascular bundle. This muscle passes through foramen ischiaticum major, dividing the latter into the upper foramen suprapiriform and the lower foramen infrapiriform, each transmitting nerve vascular bundles. The upper nerve vascular bundle passes through foramen suprapiriforme. It comprises of superior gluteal artery, superior gluteal vein, and superior gluteal nerve. After exiting the foramen, the vessels and the nerves pass in the space between gluteus medius muscle and gluteus minimus muscle. The foramen infrapiriforme transmits 3 nerve vascular bundles: deep, middle, lateral. The deep nerve vascular bundle includes internal pudendal artery and vein and pudendal nerve. It arches around ligamentum sacrospinale to enter the fossa ischianalis through foramen ischiaticum minus. The medial nerve vascular bundle comprises of inferior gluteal artery and vein and inferior gluteal nerve. The lateral nerve vascular bundle contains sciatic nerve and arteria comitans. Nerve cutaneous femoris posterior. The sciatic nerve overlies superior and inferior gemellus, the tendon of obturator internus, and most inferiorly, quadratus femoris muscle.